Hello all, good evening. Good evening, hello. So, long time no see. இருக்கீங்களா? லைவ் சாட்ல ஆளு காணுமே யாரையும். Guys, done. So today நம்ம என்ன பண்ண போறோம் அப்படின்னு பாத்தீங்கன்னா UGC NETல நம்ம ஹோம் சயின்ஸ் ரிலேட்டடா நியூட்ரிஷன் டேர்ம்ஸ், அதாவது யூனிட் நம்பர் 2ல we have a lot of terms இல்லையா, terms and definitions many are there. இது உங்களுக்கு டைரக்ட் கொஸ்டினாவும் கேட்கலாம். அப்படி இல்லைன்னா கொஸ்டின்ஸ் கேட்கும்பொழுது இந்த வார்த்தைகளை டெக்னிக்கல் வேர்ட்ஸ் வந்து உங்களுக்கு பயன்படுத்தி கேட்கலாம். ஓகேங்களா? So today what we are going to do அப்படின்னு பாத்தீங்கன்னா, லாஸ்ட் ஒரு கிளாஸ்ல when I introduced you to UGC NET home science syllabus, I gave you details இல்லையா, like from which unit what types of questions will come, how much weightage is given to each unit, the very first class. So அதுல we saw around ஒரு 10 definitions, terms and definitions வந்து நம்ம பார்த்தோம். இன்னைக்கு we are just going to continue it, okay, the terms and definitions நம்ம பார்த்ததுல. So right, ஸ்டார்ட் பண்ணலாமா? Let's go with a bit of English and Tamil, okay? A combination of English and Tamil. So terms உங்களுக்கு ஞாபகம் இருக்கும், ஈஸியாவும் இருக்கும் உங்களுக்கு படிக்கிறதுக்கு, ரைட்? ஓகே, நம்ம இப்ப பார்க்க போற டேர்ம்ஸ், வாட் எவர் டேர்ம்ஸ் வி ஆர் கோயிங் டு see now, இது எல்லாமே ப்ரீவியஸ் இயர் கொஸ்டின்ஸ். முன்னாடி வருஷம் ஏதாவது ஒரு பேட்ச்ல வந்து கண்டிப்பா இந்த கொஸ்டின்ஸ் வந்து வந்திருக்கும். அந்த மாதிரியான டீடைல்ஸ் தான் நான் இந்த இடத்துல ஷார்ட்டா உங்களுக்கு வந்து கொடுக்க போறேன். ஓகேங்களா? இப்போ ஃபர்ஸ்ட் ஒன் நம்ம பார்க்க போற டேர்ம் என்ன? ஒரு விஷயம் நல்லா ஞாபகம் வச்சுக்கோங்க, நம்ம யூஸ் பண்ற டேர்ம்ஸ் அண்ட் டெஃபினிஷன்ஸ்லாம் இருக்கு இல்லையா, இதெல்லாம் கொஞ்சம் வந்து லைட்டா அட்வான்ஸ்டா இருக்கிற மாதிரி உங்களுக்கு ஃபீல் ஆகலாம். லைக் இந்த சென்ஸ், என்ன புதுசா இருக்கே இந்த வேர்ட்ஸ், இது வரைக்கும் நம்ம இதை பார்த்ததே இல்லையே அப்படின்ற மாதிரி வேர்ட்ஸா இருக்கலாம். பட் இட்ஸ் கம்ப்ளீட்லி ஃபைன். ஓகே, ஏன் அப்படின்னா இந்த வார்த்தைகளுக்கு அப்படின்னா என்னன்னு மட்டும் நீங்க தெரிஞ்சுக்கிட்டா போதும். ஜஸ்ட் வாட் இட் இஸ், ஜஸ்ட் தட் இஃப் யூ நோ, இட்ஸ் மோர் தென் எனஃப். ஓகே, ஸோ ஃபர்ஸ்ட் டேர்ம் தட் வி ஆர் கோயிங் டு see. Okay, so the first one that we are going to see is presbycusis. Presbycusis. ரொம்ப சிம்பிள், இட்ஸ் a very simple thing. Like when a person ages, ஒருத்தவங்களுக்கு வந்து வயசாகும் பொழுது அவங்களுக்கு காது கேட்கிற திறன் வந்து குறையுது இல்லையா, அதை தான் நம்ம என்னன்னு சொல்றோம், presbycusis அப்படின்னு சொல்றோம். காது கேட்கும் திறன் வயசாக ஆக குறையிறது. ஓகே, அத presbycusis அப்படின்னு சொல்லுவோம். இன்னொரு விஷயம், வயசாக ஆக கண்ணோட பார்வை வந்து மங்கும் இல்லையா, கண் லைக் மேக்யூலர் டிசீஸ், அப்படி இதை வந்து நம்ம மேக்யூலர் டிசீஸ்ன்னு சொல்லுவோம். அதாவது நம்ம ஐல நிறைய பார்ட்ஸ் இருக்கு இல்லையா, கார்னியா இருக்கு, ஐரிஸ் இருக்கு, இந்த மாதிரி நிறைய பார்ட்ஸ் இருக்கு, ரைட்? So out of those parts there is a part called as macula. Macula is a part which is essential for central field vision. Like as you can see in the picture, இந்த pictureல தெரியுற மாதிரி one side there is a proper nice picture of a small baby girl, whereas on the other side, since the central part of the whole field, like the place where you see, no, central part la there is no proper vision. So this is because macula, which is a part of your human eye, okay, that is damaged because of aging. So அந்த மாதிரி நடக்கிறத we call it as what? We call it as macular disease, since the macula is affected. Simple as that. Okay, done. So presbycusis and macular disease, both of these are related to aging in a person. So presbycusis is related to hearing loss, whereas macular disease is related to vision loss, central vision loss. Especially these two is very commonly seen in people who are aged, okay, elder people. Done. Very simple. Shall we go to the next one? Go to the next one. Shall we go to the next one? Okay, done. So the next term that we are going to see is enuresis. Enuresis or enuresis, you can say. So in other words, you can call it as bed wetting also. That is because of urinating in the bed. Okay. Like small children, they commonly do, yeah. அவங்களுக்கு bladder control வந்து இருக்காது. They don't know how to control their urine. So they wet the bed. Right. So that is what we call it as enuresis. This is very commonly seen in young children. But when an elderly person loses his bladder control, urinary bladder control, when the person loses abdina, then also this bedwetting can happen. This is because of what? It is because of lack of urinary bladder control. Very commonly seen in both children and also in elderly people. Okay, next. Next is diuresis or polyuria. What is diuresis or polyuria? Abdin pathona, when there is excess production and excretion of urine. Okay, when there is too much production of urine, this is a very common symptom of diabetes. Like diabetes people, if you see, they have this urge to urinate every like 1 hour or every 2 hours. They feel like urinating again and again, and they will have high amount of thirst also. So three things solvom actually diabetes people ke. Diabetes ke enna solvom, one is excess urination, which is this diuresis or polyuria, and they will have too much hunger also, which is called as polyphagia. That is too much hunger, excess food they feel like eating. Next, another one is what it can be. What the other one can be? One thing is that they feel very thirsty. One thing is that they urinate a lot. One thing is they eat. They feel like eating a lot. Excessive hunger. Polyuria, polyphagia, and we call it as polydipsia. Okay, polydipsia. Right? So excessive hunger, excessive urination, and excessive thirst. Okay, now among that we are seeing only one, which is polyuria, excess amount of urine production. Common during diabetes people, common in diabetes people, but it is also common when a woman is pregnant. Why? Why? Because when a woman is pregnant, her uterus size will be increasing. Like baby is growing inside, no? So the uterus size will be increasing. So when the uterus size is increasing, it pushes on the bladder, the urinary bladder, which reduces one thing, it reduces the size, the whole capacity. Size and solla mudiyadhu, there is no space to expand actually. And also there is pressure on the urinary bladder. So women who are pregnant, especially in the second and third trimester, they also feel like urinating quite frequently. Okay, so that is called as diuresis or polyuria. Okay, next one is actually three different words can be given for that. You can call it as edema also. If you can put OEDEMA also, you can put EDEMA also. Both are same only. Edema, or it can be called as dropsy also. What is this exactly is? Like, I think you might have noticed this very commonly. Like, நீங்க ரொம்ப தூரம் travel பண்ணி போறீங்கன்னு வெச்சுக்கோங்களேன். If you're traveling for a very long distance of time, you are like, your leg is in the same position. You could not walk, or maybe there was no facility to move your legs, or there was no leg room properly. Then your legs will feel very swollen. Okay, right? Why is this? It is because there is no proper blood flow to that particular part. There is no proper blood circulation. So that is called as, it is accumulation of fluid in any part of your body. You can call it as edema, or you can call it as dropsy also. Both are same only. Okay, now either generally for everybody, when they put their leg down for a long time, it happens. But for a few people, like kidney disease irukra people or cardiac disease irukra people, this happens very commonly, even if they are not sitting in the same place. Okay, like different parts of the body, especially leglayum, handlayum, avங்களுக்கு வந்து நீர் தேங்கும். அததான் நம்ம என்னன்னு சொல்றோம், we call it as edema. Okay, the excessive accumulation of fluid in the extremities, especially in the extremities parts of the body. Extremities na onnum kediyadhu, your legs and hand da extremities nu solren. Okay, but this can happen in all other places also. Like your fluid can accumulate in your stomach, your thighs, in different parts of your body. And if the fluid accumulates in the abdominal cavity, In the peritoneum, we call it as peritoneum. Okay, in the terms, if you don't know, it's completely fine. Anyway, we are going to study this. So, in the term, we call it as ascites. ASCITES, ascites. Okay, simple. Body, in case if your body is accumulating a lot of fluid, that is called as edema. It is very commonly seen in people who have kidney disease or cardiac dysfunction, because idu rendu irukumbodhu there is too much of blood volume. If cardiac disease abdina blood சரியா circulate ஆகாது, whereas in terms of kidney disease, kidney நம்ம பாடியில இருக்க fluid கரெக்ட்டா like filter out பண்ணல அப்படின்னா too much fluid will be there in our body, right? So because of that there can be edema. Okay, and if the edema is developed in your abdominal region, in the peritoneum, then it is called as ascites. Okay, greater than 25 ml of fluid, if it is accumulated in your abdomen, it is called as ascites. And this can also happen in people who consume too much of salt, like sodium retention. If it is there, then that will also lead to edema. Next is oliguria. Same thing, related to urine only, but a small change. In terms of oliguria, if you see, then there is excess, there is reduced amount of urine production. Like your kidney is not functioning properly. Okay, your kidney does not function properly here. Then what happens? That the amount of total urine produced in a single day, that will be less than 400 ml. If that is the case, or less than 25 ml per kg per 24 hours. Like basically, there is reduction in urine production. Okay, that is called as oliguria. So when will this happen? This will happen in people who have not proper kidney function. Like if your kidney function is not okay, then it will lead to oliguria. So 3 things related to urine we have seen till now. One is diuresis or polyuria, which is nothing but excess amount of urine production. Okay. Next, we have seen oliguria, whereas there is a reduced amount of urine production. Very simple. Both of this is very commonly related to your kidney and also cardiac disorders, especially the thing that we saw, the edema thing and all, no, that is also kind of related to your kidney only, but specifically related to urine. If you see polyuria, this polyuria, otherwise you can call it as you can otherwise call it as what? You can otherwise call it as diuresis also. Another one is oliguria. So these things you don't have to memorize and all. Just if you remember, oliguria is related to reduced urine production. Polyuria is related to excess urine production. This much if you know, it is more than enough. Okay. Don't think that, oh, there are so many terms. How will I study? I don't belong to nutrition. No, nothing like that. They are very simple. If you know these terms, before we go into the actual nutrition topic, it will be very easy for you to study. Okay, we will study about kidney, we will study about liver, but very basic things in a very easy way we'll study. But before that, if you could know these terms, it will be very easy for you. Okay, done? Okay, next. What is it? Azotemia. Azotemia. What is azotemia? When your kidney, okay, when your kidney is not functioning properly. So basically, what are the functions of kidney? Kidney has to remove the waste products which are there in your blood, and it has to excrete it out of your body. Like there are many waste products in human body, like nitrogen metabolism. From nitrogen metabolism, we get urea, uric acid, creatine. Like this, many compounds are waste products. So your main function of the kidney is to remove these waste products and throw it out of the body via urine. So when your kidney is not functioning properly, whatever waste products are there in your blood, no, they will get accumulated, especially nitrogenous waste products. Where do these nitrogenous waste products come from? They come from protein metabolism. If you don't understand this now, like how nitrogen is getting produced from protein metabolism, completely fine. Just know one thing, that in protein, okay, in amino acids in protein, there is presence of nitrogen. And that nitrogen is one of the waste products. In many ways, it is like thrown out of the body, like in urea form, uric acid form, creatine form, like this, many are there. So these nitrogenous waste products, it is the function of kidney to remove this and throw it out of the body. Now, when kidney is not functioning properly, of course, fluid will also not get accumulated, fuel will not be thrown out of the body. This waste products will also not be thrown out of the body. So accumulation of fluid, we just now saw, it is called as edema. Like accumulation of fluid in different parts of your body. The person looks like he has, like it is like a balloon. Okay. But in terms of acidemia, waste nitrogenous products, these are toxic products. That is the problem here. These are toxic products which are accumulating in the blood. Okay. This leads to a lot of other problems. See, when toxin is accumulating in your blood, there will definitely be problems, right? So that accumulation of nitrogenous waste products is called as acidemia. So now if you get a question asking, one side in the match the following, they give acidemia. In other side, if they give you impaired kidney function, what will you match? You have to match acidemia with impaired kidney function, because when kidney is not functioning properly, your waste products will not be thrown out of the body. So nitrogenous products will get accumulated, which is called as acidemia. Simple. Is it clear? Clear? Is it clear? I hope it's clear. Is it okay? Perfect. Perfect. Now, let us see another term which is related to kidney failure itself. Okay. Now, I want you to remember one thing. In that as of now, nutrition, if you don't belong to nutrition in a like subject abdina, a few things you may not know. So one thing that you have to keep in your mind is that kidney, it has a lot of functions. Like other than your other than urine production, other than removal of waste, kidney has a lot of functions. And among that, one of the functions is to regulate your calcium balance in your body. To regulate the calcium balance is one of the important functions of kidney. So when your kidney is not functioning properly, there can be problems related to bone also. We very easily know that calcium deficiency and vitamin D deficiency leads to bones related problems. But who might have thought that kidney problems will also lead to bone related problems? But it actually happens. So when you have some kind of a kidney problem, okay, some kind of a kidney disease, what happens is that there is abnormal formation or abnormal changes in the growth and also in the way bones develop. Okay, that type of abnormal changes because of a kidney related problem or kidney failure, that is called as osteodystrophy. Osteo, this word osteo, I think it is related to bone. In some way, if it is related to your skeletal system, we use this word osteo, ortho, like these and all. Whereas dys is this dys, wherever you see this prefix, it refers to irregular or imbalance. Okay, like how we say hypo is less and hyper is high, like that, dys is some kind of a disturbance or imbalance. So here there is imbalance in the calcium growth and development because of your kidney failure. And this mainly happens because your kidney has a lot of function to do related to your calcium metabolism, vitamin D metabolism, phosphorus metabolism, and hormone metabolism, etc. Simple. Osteodystrophy is one of the, you can say, one of the symptoms, or you can say signs, or like something which happens because of kidney failure, something which is irrelevant. But it actually happens. In reality, it happens. So osteodystrophy is related to impaired kidney function. Just that if you remember, it's good enough. Next, let us see a few things related to your liver. Okay, to your liver. Now, I think all of you know that bilirubin is one of the, you can say, one of the fluids which is produced by your liver. Like I think we know now, liver is a part of human body, kidney is a part, heart is a part. In that, every part will have its own secretion, or every part will have its own different incomponents. Now, when it comes to liver, it produces this fluid called as what? Bilirubin. Okay. When this bilirubin levels are high in the blood, when high levels of bilirubin is there in the blood, it is called as what? Hyper. We already know this word hyper refers to high, right? Hyper bilirubinemia. EMIA, it refers to level of a particular component in blood. Okay, URIA, if you see nuria, if you say nuria, like that, if you see, then it refers to quantity present in urine. Anemia is present in blood, quantity of a particular compound in blood. Whereas if it is urea, if it is present in urine, then we call it as URIA. Not UREA, URIA. That last, like that small part, like we call it as a suffix, no? Like that. Now, hyperbilirubinemia, it's a little difficult to pronounce, but the word refers to high levels of bilirubin in your blood. Simple as that. Now, why high levels of bilirubin would be present in the blood? Simple. Now, this bilirubin is one of the breakdown products of your RBC. What is RBC? RBC is red blood corpuscles or ratta sigapanukal, if you could say. So when this RBC, after they live only for 120 days, no. So after this 120 days, the RBC, after they will die, no. So when they die, one of these products called as bilirubin is produced. This bilirubin, when your liver is not functioning properly, okay, it cannot be thrown out of your body. High levels of bilirubin will be present in your blood. When high levels of bilirubin is present in your blood, this pigment, this is actually a yellow color pigment. Okay, this yellow color pigment can go and stick to your skin, your elastic tissues, basically like your skin, eye, these kinds of parts, it can go get itself fixed. So it will make your skin and eyes and all turn yellow in color. Like, can you remember what it is called generally? We call it as jaundice, right? So in jaundice also, when there is high levels of bilirubin, it leads to this yellowish discoloration of your skin, your eyes and all. Okay, simple. What is hyperbilirubinemia? High levels of bilirubin in the blood. If you see this suffix EMIA, it refers to presence in blood. If you see URIA, it refers to presence of a particular compound in the urine. Okay, simple. Can you remember small things like this? Is it okay? Is it chill? All okay? Expecting some replies, guys. Am I audible? Okay. Look, let's go to the next one. Next is something, a few of these terms will be quite random, okay? Like here and there. Like it will be very random. And they are very simple also to remember. You don't have to, remember the spelling, exact spelling and all. If you know how it sounds, it's enough. And if you know, it's more than enough. So what is this word cardiomegaly means? Again, cut the word into two. Cardiomegaly. So cardio, it refers to heart. Like you might have seen in hospitals, no? So this word cardio, it refers to heart. The word megaly, it refers to increase in size. Okay, enlargement, increase in size. So when your heart size increases, it is called as cardiomegaly. And what are the reasons why your heart size could increase? If you could see, there are multiple reasons, like because of high blood pressure, because of some kind of a blockage in your blood vessel, because of some infection, or because of excess growth of muscles in your heart, the excess growth of muscle fibers. All of this can lead to the increase in your heart size. Okay, just know that cardiomegaly is nothing but increase in heart size. Enough. If you know this much, it's enough. Next is hemophilia. What is hemophilia? I'm reminding you once again, whatever we are discussing here, this is not high level subject. All of these terms, they have come in your exam, in your UGC NET exam, in some or the other way. Okay, they might have used it in a question or in a match the following, direct words, like this they might have used. So that is why in the beginning of the classes itself, I'm introducing you to all these terms. Now, what is hemophilia? Hemophilia, it is a type of bleeding disorder. So basically, whenever we get hurt, what happens? Whenever we get hurt, there's always clotting mechanism, right? Once you get hurt, maybe for 1 or 2 minutes, you will bleed and then you will properly start clotting. Like ரத்தம் வந்து கட்டி போயிடும் இல்லையா? பட் ஆனா ஹீமோஃபீலியா இருக்கிற பீப்புளுக்கு, for these people, because of some defect in the blood clotting mechanism, this blood clotting mechanism has around 13 steps, okay? But we are not going to see those steps and all. But because of some difference, because of some problem in one of the factors involved in the blood clotting mechanism, these people, if they get hurt, their blood will not clot only. Okay, their blood will not get clotted. They will keep on losing blood. Okay, so there are many disorders like that. In that, one type is hemophilia. So hemophilia, this is an inherited disorder. That is like from your parents, you get such kind of disorders. We call them as inherited disorders. Now, in hemophilia also, there are two main types, hemophilia A and hemophilia B. There are a few other names also. Like hemophilia A is also called as classic hemophilia or factor 8 deficiency. Or the next one is hemophilia B. It is also called Christmas disease or factor 9 deficiency. Like I told, there are 13 different, blood clotting factors which are involved in the clotting mechanism. So out of that, 8 factor is related to hemophilia A, whereas factor 9 is related to hemophilia B. Very simple. You just have to remember that hemophilia is a blood clotting disorder and this is a genetic disorder. And people who have this hemophilia, if they get hurt, they will lose a lot of blood because their blood will not clot properly. Okay. Next one is sudden infant death syndrome, or you can, in short words, you can call it as SIDS. SIDS, sudden infant death syndrome. This can also be called as cot death, or it can be called as crib death also. So basically what happens is that the baby will be very healthy. Okay. No signs of a disease or no signs of distress, nothing. One day the mother will go and put the baby to sleep, and the next day morning when the mother goes and sees, the baby will be dead. So the reason for such kind of a death is usually unknown, but people say that it is mainly because of suffocation, like மூச்சு திணறல் காரணமா அந்த குழந்தை இறந்திருக்கும் அப்படின்னு சொல்லுவாங்க. But it's mostly unexplained. You cannot say. ஒரு வயசுக்கு யூசுவலா இது வந்து you can see only in children who are below 1 year of age. Okay. So the baby will be quite healthy. There will be no problems, no medical problems. But next day morning when they wake up and see, the baby will be dead. Okay, such is called as sudden infant death syndrome or SIDS. So this risk, how it can be reduced? It can be reduced in a few ways. Like if you make the baby sleep on their back, like few mothers, they have a habit of making the baby sleep on their stomach. Okay, but that is not a good thing. The baby has to sleep on its back. And they are say that pacifiers irukku illaya, rubber nu solluvom tamil la, and rubber kadicha honey taste varumnu solluvaanga. So using pacifiers, குழந்தைங்களோட வாயில அந்த pacifiers வச்சு அவங்க நைட் டைம்ல அதை சக் பண்ணிட்டே தூங்குனாங்க அப்படின்னா, the risk of death because of sudden infant death syndrome is reduced. There is a lot of research which has proved. So a few other things are also there, but main the risk factors could be reduced by making the baby sleep on its back. Next thing is that by inserting this pacifiers so that the baby will not suffocate at night. Simple. Sudden infant death syndrome, it can be called as cot death also. It can be called as crib death also. Okay. Shall we go to the next one? Right. So next we are going to see two different diseases, Alzheimer's disease and Parkinson's disease. These things also, they are very commonly asked in your exam. Okay, ரொம்ப காமனா கேக்குற ஒரு டாபிக் இது. பட் ஆனா இன்டெப்த் எல்லாம் கேட்க மாட்டாங்க. They don't ask it very in depth or ரொம்ப டெக்னிக்கலா மெடிக்கலா they don't ask. This can be இது ஏன் முக்கியம், why this particular Alzheimer's or Parkinson's is important அப்படின்னு பாத்தீங்கன்னா, this can be a part of your human development also. Actually இது வெறும் nutrition related கிடையாது. This can be related to human development as well. So this has importance 2 units ன்றதுனால they can ask you question from either of the units. இதுல வரலனா அதுல வரலனா இதுலன்ற மாதிரி. So what is this? இப்ப Parkinson's and also Alzheimer's, both are something related to brain ன்றது எல்லாருக்குமே தெரியும்னு நினைக்கிறேன். But I'll give you the difference between Parkinson's and Alzheimer's. So இப்ப Alzheimer's அப்படின்னு எடுத்தீங்கன்னா, இது வந்து this is a brain disorder wherein ஒரு பர்சனோட memory, the memory skills of a person, thinking skills of a person வந்து destroy ஆகும். ஸோ இந்த இடத்துல அவங்க வந்து மறந்துடுவாங்க, நிறைய விஷயங்களை மறக்க ஆரம்பிப்பாங்க. அண்ட் இதுல நடக்கிற அந்த மெமரி லாஸ் இருக்கு இல்லையா, திஸ் பிரெயின் டீஜெனரேஷன் விச் இஸ் ஹேப்பனிங், இட் இஸ் irreversible. அண்ட் irreversible மட்டும் கிடையாது, இன்க்ரீஸ், இட் வில் கீப் ஆன் இன்க்ரீசிங் டே பை டே. லைக் மேபி முதல் நாள் வந்து அவங்க எங்க கீஸ் வச்சாங்கன்னு மறப்பாங்க, நெக்ஸ்ட் டே தே மே forget about their dog or their dog's name, or next day they will forget about themselves, what they used to do earlier. இந்த மாதிரி கொஞ்சம் கொஞ்சம் கொஞ்சமா அவங்க மெமரி வந்து ஃபேட் ஆயிட்டே இருக்கும் when a person has Alzheimer's. And the worst thing about Alzheimer's is that there is no cure, there is no vaccine, and there is no treatment protocol. There is only management protocol, disease பொறுத்த வரைக்கும். So Alzheimer's disease, the main symptom, if they ask you, it is dementia. What is dementia? Dementia அப்படின்னா memory loss. When a person has like memory related issues, he's forgetting things quite a lot, then other dementia அப்படின்னு நம்ம சொல்லுவோம். ஓகே. அண்ட் அல்சைமர்ஸ்ல இன்னும் ஒரு டெக்னிக்கல் வேர்டு இருக்கு. இந்த வேர்டு ரிலேட்டடா இது வரைக்கும் கொஸ்டின்ஸ் வந்தது கிடையாது. These questions have not come in exam, but you can expect that they will use these kind of technical words. So what is sundowning effect அப்படின்னா, the sundowning effect is very commonly seen in the Alzheimer's patient. Okay. So இந்த Alzheimer's patient என்ன பண்ணுவாங்க அப்படின்னா, கொஞ்சம் தெளிவா இருப்பாங்க. During the day time they may be a bit okay. But towards the evening, towards the night time, they will lose consciousness. Like they'll be very confused, they will have a lot of fear, anxiety, and இதெல்லாம் இருக்கும்போது definitely you will get aggressive, right? Like என்ன நடக்குதுன்னே புரியல, if you don't know what's happening around you அப்படின்னா, then you will get irritated definitely. So in the person, when a person has Alzheimer's, that's what happens. And this has a specific name called as sundowning effect. So when the sun is going down, this person will experience these kind of aggressive symptoms அப்படின்றதுக்காக the sundowning effect அப்படின்னு சொல்லி we call it. And Alzheimer's disease, உலகத்திலேயே the most common cause of dementia, if you take, it is Alzheimer's disease. Okay. Now, let us see another term called as weight cycling or yo-yo effect. I will teach you about Parkinson's disease also. Okay. But Parkinson's disease, still now, it has not come in your exam. They have very commonly asked about Alzheimer's. எனக்கு தெரிஞ்ச ஒரு 5 to 6 times question வந்திருக்கு Alzheimer's related. But Parkinson's not quite so much. The reason may be because it's not much related to nutrition per se. பெருசா nutritionல it is related கிடையாது. Parkinson's is also quite similar to Alzheimer's தான். But the difference is that in Parkinson's disease, there is a significant reduced amount of dopamine. Dopamine is a chemical, as you might know, it's a chemical transmitter. Now, அந்த டிரான்ஸ்மிட்டரோட அளவு குறையும் பொழுது அதை வந்து ப்ரொடியூஸ் பண்ற நியூரான்ஸ் இருக்கு இல்லையா, அதை வந்து டோபமைன் எனர்ஜிக் நியூரான்ஸ் சொல்லுவாங்க. ஸோ டோபமைன் ப்ரொடியூஸ் பண்ற பிரெயின் செல்ஸ். ஓகே. அந்த பிரெயின் செல்ஸோட டெத் நடக்கிறதுனால இனாஃப் அமௌண்ட் ஆஃப் டோபமைன் வந்து ப்ரொடியூஸ் ஆகாது பார்க்கின்சன்ஸ் டிசீஸ்ல. ஸோ டோபமைன் நம்மளுக்கு இனாஃப் அமௌண்ட் ஆஃப் ப்ரொடியூஸ் ஆகலைன்னா நம்மளோட மூவ்மெண்ட்ஸை நம்மளால கோஆர்டினேட் பண்ண முடியாது. யூ கேனாட் கோஆர்டினேட் யுவர் மூவ்மெண்ட்ஸ். லைக் இஃப் யூ வாண்ட் டு வாக், யூ டோன்ட் டேக் அ கான்ஷியஸ் எஃபர்ட். நோ, இட்ஸ் லைக் இஃப் யூ வாக் அவ்வளவுதான். But when a person has this dopamine deficiency, their legs or hands will not listen to what they are saying. Okay, it will go in different directions. And the mari in Parkinson's disease. And Parkinson's disease, there may not be memory loss. But Alzheimer's, the main thing is memory loss. People will have dementia. That's the hallmark when it comes to Alzheimer's. But in Parkinson's, movement related problems இருக்கும். அவங்களால சரியா நடக்க முடியாது, நடக்கும்போது விழுந்துருவாங்க, சரியா பேச முடியாது, சாப்பிட முடியாது, முழுங்க முடியாது. அந்த மாதிரி கோஆர்டினேஷன் ரிலேட்டட் இஷ்யூஸ் வந்து வெரி காமன்லி யூ வில் see in Parkinson's disease. அண்ட் அங்க பார்க்கின்சன்ஸ்ல டோபமைன் டிஃபிஷியன்சின்றது கீவேர்ட், இங்க டெமென்ஷியா அப்படின்றது கீவேர்ட். ஓகே, ரைட். லெட்ஸ் கம் டு தி நெக்ஸ்ட் ஒன். வெயிட் சைக்கிளிங், இதை வந்து யோயோ எஃபெக்ட்னு சொல்லலாம், யோயோ டயட்டிங் அப்படின்னு சொல்லலாம். This term, it was introduced by a scientist called as Kelly D. Brownell. இவர் என்ன சொன்னாரு அப்படின்னா, when a person in like a cycle mari, he will lose weight, he will gain weight, he will lose weight, he will gain weight. அந்த மாதிரி cyclically if a person is doing அப்படின்னா அவங்களோட மெட்டபாலிசம் ரொம்ப அஃபெக்ட் ஆகும் அப்படின்னு he proposed a concept, and that concept is called as weight cycling. Like there might be a few people, no, like they will diet, they will reduce weight, they will leave the diet, they will gain weight, திரும்ப they will diet and lose weight. So like this continuously, if you are doing this dieting eating kind of thing multiple times throughout your life, it will affect your metabolism. That is what he proposed. இததான் அவர் ப்ரொபோஸ் பண்றாரு. This term was asked very recently in your exam. ரொம்ப சிம்பிளா டைரக்டாவே கேட்டிருந்தாங்க. நான் டெஃபினேஷன்ஸ் ட்ரீட் பண்றதுக்கான லைக் உங்களுக்கு வந்து டீச் பண்றதுக்கான ரீசனுமே அதுதான். லைக் அட் டைம்ஸ் இஃப் யூ ஆர் குவைட் லக்கி, நம்ம படிக்கிற டேர்ம்ஸ்லேயே சில டேர்ம்ஸ் டைரக்ட் கொஸ்டின்ஸா வந்துடும். பட் டைரக்ட் கொஸ்டினா வர டேர்ம்ஸ் தே வில் நாட் பி ஈஸி டேர்ம்ஸ். அதுதான் அந்த இடத்துல ஹைலைட். தே வில் பி ஆஸ்கிங் அ வெரி சிம்பிள் டைப் ஆஃப் கொஸ்டின், பட் ஆனா த வேர்ட் விச் இஸ் யூஸ்ட் தேர் வில் பி டிஃப்ரெண்ட். Like if you have not heard only about yo-yo effect அப்படி இல்லைன்னா வந்து யோயோ டயட்டிங் இந்த வார்த்தையில நீங்க கேட்டது இல்லை அப்படின்னா நம்ம கரெக்டா பதில் சொல்ல முடியாது இல்லையா அந்த இடத்துல. So you have to get familiar with these kinds of words. Okay, now I have added a question படிச்சு பாருங்க. கொஸ்டினை படிச்சுட்டு let me know which will be the correct answer. ஆன்சரை பார்க்காதீங்க, let me know which will be the correct answer. ஸோ என்ன கேட்டிருக்கோம்னா காமன் சிம்டம்ஸ் ஆஃப் அல்சைமர்ஸ் டிசீஸ். அல்சைமர்ஸ் டிசீஸ்ல காமனா நீங்க பாக்குற சிம்டம்ஸ் எது எதெல்லாம், அதுதான் கேள்வி. ஸோ இதுல வந்து ஜஸ்ட் செக் பண்ணீங்கனாலே ஈஸியா ஆன்சர் பண்ணிடலாம். முன்னாடியே சொன்ன மாதிரி அல்சைமர்ஸோட ஹால்மார்க் இஸ் மெமரி லாஸ். ஸோ டெஃபினட்டா மெமரி லாஸ் வந்து உங்க ஆப்ஷன்ல இருக்கணும். ஸோ அப்படி பார்த்தீங்கன்னா பி ஆப்ஷனை டிலீட் பண்ணிடலாம். மிச்சம் இருக்கிறதெல்லாம் பாருங்களேன், ஆன்சைட்டி, ஆங்கர், டிஸ்ஓரியன்டேஷன், இதெல்லாம் தான் வந்து நீங்க ஒரு குழப்பத்துல இருக்கீங்க, ஒரு பர்சனுக்கு உங்களுக்கு கன்ஃபியூஸ் ஆகுது, உங்களுக்கு மெமரி லாஸ் ஆகுது அப்படின்னா கண்டிப்பா வந்து யூ வில் பி ஆங்கிரினோ, எப்பயுமே இதை நடந்துருமா அது நடந்துருமா, ஆன்ஷியஸ், யூ வில் பி வெரி ஆன்ஷியஸ் ஆல்சோ. ஸோ லைக் தட் a person who has Alzheimer's is commonly known to have dementia. அது பக்கா பாயிண்ட். பட் the other two things which is quite related to the memory loss அப்படின்னு பார்த்தோம்னா being disoriented, என்ன நடக்குதுன்னே தெரியாம இருக்கிறது, நாங்களை சுத்தி நான் எந்த ஊர்ல இருக்கேன் அப்படின்னு கேட்கிற மாதிரி. So disoriented and also they might be quite anxious and angry also. Okay, so tomorrow in our class we will start with expected terms. Till now I will share the PPT. உங்க வாட்ஸ்அப் குரூப்ல I will share the PPT. ஓகேங்களா, for paid students I will share the PPT. expected terms ஓடது, சாரி PYQ terms ஓடது. And today's RDA test இருக்கு இல்லையா, I have informed you that today we will have a test related to RDA 2020 and vitamin A, vitamin C. இது ரெண்டு மட்டும் படிச்சுட்டு வாங்கன்னு சொல்லியிருந்தேன். நேத்தி கொடுத்ததுல மேக்ஸிமம் 2 பேர், எனக்கு ஆக்சுவலா ஒருத்தர் தான் பதில் சொன்னாங்க and she got full marks. Very happy. Like this we will do 2 nutrients per day. ஜாஸ்தி எல்லாம் வேண்டாம், just 2 nutrients if you can do per day and practice it using the test, it's enough. Okay, and today's test already post ஆயிருக்கும் and you can go attempt it. Vitamin A and vitamin C ஓட RDA of 2020, the PPT that I have already shared with you. And if you have any doubts you can ask me now. நாளையில இருந்து we will start. நாளைக்கு we will have a class related to your expected terms. Okay, any doubts இருந்தா சொல்லுங்க. chat boxல கமெண்ட் பண்ணுங்க, I will answer for you. ஓகேவா? Yes, definitely from February. Yes. No, not exactly. அந்த மாதிரி இருக்காதுமா. Not every day. A few days you will have live class related to paper 1, but mostly morning தான். paper 2 பொறுத்த வரைக்கும் உங்களுக்கு மார்னிங் கிளாஸஸ்க்கு ஷிஃப்ட் ஆயிடும். So don't worry. February 5th ma. February 5th your paper 1 classes are starting. February 5 குள்ள the target that I have for you in home science na RDA ல இருக்கிற எல்லா நியூட்ரியன்ஸையும் ரெண்டா கொடுத்து I want to finish the most important nutrients. ஓகே, அதுக்கான குவிஸ் ஒரு 10 குவிஸாவது அதுக்குள்ள போஸ்ட் பண்ணணும். 10 or அட்லீஸ்ட் ஒரு 8 குவிசஸ் ஆவது போஸ்ட் பண்ணணும். அண்ட் பிஃபோர் யூ கோ ஃபார் யுவர் பேப்பர் 1, அந்த பேப்பர் February 5ல இருந்து 1 வீக் உங்களுக்கு பேப்பர் 1 கிளாஸஸ் இருக்கும். அந்த டைம்குள்ள இங்க நம்ம படிச்சது எல்லாம் இப்போ உங்களுக்கு ஆக்சுவலா கிளாஸஸ் வந்து லைவ் கிளாஸஸ் போயிருந்தாலுமே the most important topics தான் டீச்சே பண்ணிருக்கோம் லைவ் கிளாஸ்ல. லைக் டைம் பாஸ் பண்ற மாதிரி எந்த டாபிக்ஸ்மே கிடையாது. எவ்ரி டாபிக் இஸ் இம்பார்ட்டன்ட் ஃப்ரம் எக்ஸாம் பாயிண்ட் ஆஃப் வியூ. ஸோ அதுல ஒரு டெஸ்ட் வச்சு உங்களை அங்க அப்படியே பேப்பர் 1க்கு அனுப்பலான்றது தான் ஐடியா. ஓகே, all right. வேற டவுட்ஸ் இருந்துச்சுன்னா எனக்கு தனியா கூட மெசேஜ் பண்ணுங்க. ஐ கெஸ் ஆல் ஆஃப் யூ ஹேவ் மை நம்பர், ஸோ யூ கேன் மெசேஜ் மீ. ஓகே, இப்போ ஆர்டிஏவோட டெஸ்ட்டை போய் அட்டன் பண்ணுங்க. ஆர்டிஏவோட வைட்டமின் ஏ வைட்டமின் சி டெஸ்ட். ஓகே ஓகே, டன். பாய்.